And I suppose to move into and look at kind of like lifestyle stuff then, what can we do? You've mentioned about the healthy diet, and you mentioned before that some people find it good to practice maybe mindfulness and yogas and that. And yoga, do you find that anecdotally I suppose, are you finding that other women are giving you tips of what worked for them? Like I'm sort of saying caffeine for me and the headaches. Absolutely. Do people come to you sort of saying, you know what was a life changer for me when I did?
Yeah.
Or when I took, and I know you've touched the evening primrose and stuff like that. Is there any other kind of...
Well, I think it's probably useful to touch base with other people, and even going to yoga where you're meeting other people. Because I suppose just in this time we're going through, which is our COVID time now, where you're not, I mean, so you might very well be isolated at home with your hot flushes, which is bad. So obviously things work for different people. And at least, you're getting out there, you're talking to other people, you're sharing your symptoms and you're trying different things. All of that is great, and we don't know. It's a funny old time, and different things will work for different people. Medicine hasn't got all the answers here. So if you can find something that's good for you, and as you said, dropping the coffee was a great idea because it'll have helped your system anyway. So yeah, I think...
I think it's such a shame, particularly I find even with HSE staff, like we have over 85% of our staff are women, and yet nobody talks about the menopause. And I find even myself, sometimes I say something, menopausal brain again. Yeah. And I get this look from other women, like I'm nearly, letting down the sisterhood. Yeah. That I think sometimes women maybe, and I'm not sure if you agree, lack this thing of reaching out to each other for help. And to discuss it, because if there's so many of us out there and it's a natural stage of life, why are we so
I think it comes down to
that?
We're maybe it's that we want to be super women a little bit. We're not, but you have to keep up the facade. You can't really sort of it's maybe it's that, but it's normal, it's natural. People suffer with it, and it's just a normal part of life. It's a little bit interesting, that ad we've seen on the tampon ad that has caused all the consternation.
Yes.
That people just were not ready to have that ad, and it has stirred up all sorts of things. So it's a little bit, we haven't even got to menopause yet. Can you hear the ad where they're saying, now girls, let's get going with this old menopause business, they'll be shut down. But it is a normal part of life, and I think it's great, women together and women talking about the different things, so that you realise you're not going off your head, you're not mad, it's normal. This is how it's reasonable to feel like this, and you can make things better. So whatever you have to do to make things better, that's good, I think.
What should we do? Because you mentioned as well earlier about this, once we go through the menopause, that our risk of heart disease increases.
Yeah.
What should we be doing? Because once we come out of the menopause, our life isn't over either. We're into hopefully the lovely stage of our life.
We're into we've gone with stage 3, I think. So the first time is juniorhood, then it's making babieshood, and now it's time for us. And of course it's a third of our life, mid-time. So you want this to be good, and you want to be as fit and healthy as possible. So you want to do everything you have to do. So you're going, we have our pap smears there, so you want to be up to date with your pap smear. Now they've been suspended during this last period and they're not fully back on track yet, but will be. So when the notice comes, you get 3 notices, but bounce on the first one and go for it, because
this is our cervical check letter that comes in.
Yes, exactly.
Okay.
And get that. That's worth doing. Get it done. It's great. Normal result, off you go. Breast check then is the next thing, because of course the biggest risk for breast cancer is increasing age. So and family history, so have breast check done, great, and that's the next thing. And then with the drop in estrogen, it has an effect on cholesterol. So whereas estrogen was protective before menopause, after menopause that protection is gone, so cholesterols are more likely to rise up. Of course then that affects the blood vessels, so atherosclerosis, which it happens later in women because we're protected by our estrogen, but after we've come through the menopause we follow the male pattern. So cholesterol and atherosclerosis starts raising its head at this stage, so need to be aware of that and keep an eye on cholesterol, which again is helped by healthy diet and exercise. And also blood pressure can start going up at this stage. And as we mentioned before, any excess weight will tend to go on around the midline, which again is a cardiovascular risk factor.
Okay. So ladies like me that are more the apple shape, we're higher risk.
I don't think so, Adrian.
Oh, believe me, yes. But that's where we store it more around our middle as opposed to our hips and thighs. Isn't that higher risk for cardiovascular?
Yes, it's abdominal obesity has the link up to cardiovascular disease.
Okay. Yeah. So should we check our waist measurement from time to time? Or?
Waist measurement is done,
Okay.
and then the weight, which is your body mass index, which is a function of weight and surface body area, and sort of we're trying to keep that 25 or less. So as that raises up, you get in, and once that goes over 30, you're getting into danger zones.
Okay. Yeah. And then aren't we also, after the menopause, likely to, unless we protect our bone health, suffer from osteoporosis? Isn't there a link there as well?
There is a link, absolutely. Osteoporosis, and particularly if someone has a family history or is of a very fine-boned type of build, or at different stage in their lives may have had illnesses, or different problems back, maybe anorexia or bulimia or different things back in the past where your diet wasn't good and your bones may not be that strong to begin with. So yes, osteoporosis, which is your brittle bones is pretty much the thing. So yeah, that's protected by calcium and vitamin D. When you take vitamin D, it makes calcium go into your bones. Again, your routine blood check is important there, just to check the levels of calcium and that sort of thing. So exercise, calcium, vitamin D is very helpful for building bone strength. Now, if a person is at particular risk or has had a fracture, maybe based on something simple, a simple fall or something like that, they may be referred for a DEXA scan, which checks out the whether they have osteoporosis or so normal osteopenia, osteoporosis. So not everybody has a DEXA, but if you have a concern or have had a risk factor or a family history, a DEXA scan may be indicated.
Okay. And they could kind of consult their GP in relation to that?
Absolutely.
Because the referral, I think, would come from the GP, is that right?
Yeah.
Okay. And just to remind people, for our staff, we also have a series of videos, short YouTube clips, on the topic of osteoporosis prevention and diet and weight bearing and resistance exercises. So keep a lookout for those as well. Trace, that was absolutely fabulous. I think you really helped to demystify a lot of the myths and taboos and stuff around the menopause, and definitely have given us a lot of preparation.
I'm just thinking about
advice.
one other thing that might be confusing, just in terms of HRT itself and the different types of HRT.
Sure.
I don't know whether that might be probably relevant, because there are two types. Just to be aware of it. There's sequential and combined. So for the ladies who are still having periods or are less than a year since their last period, they would need a sequential type HRT, in which they would, when they're taking that, would continue to have periods. But the older ladies who are more than a year would go on a combined HRT, so they don't have periods. So there are different. So just in case, it's one thing that can be a little bit confusing. And the other thing too, that we're swinging much more to with HRTs and the safeties of HRT, much more emphasis now on the patches, transdermal estrogen, which is safer.
Is that the slow release one?
It's a slow release patch you use twice a week, yes indeed, and that is that's very, very safe from the point of view of thromboembolism or that sort of thing. and also the newer types of progesterone. So
Yeah. Because a lot of people with maybe a history of breast cancer in their family and stuff like that are a little bit wary of the
breast cancer
HRT.
itself, and understandably so. They with this it's interesting actually. The what I had just one little one that we had on a study there, which is very interesting on understanding the risks of breast cancer. I was just looking at it there, that on combined this was a study done on per 1,000 breast cancer incidence per 1,000 women aged 50 to 59. So you would have 23 cases of breast cancer in the UK general population per 1,000 women. That would be the baseline thing. An additional 4 cases in women on combined HRT, which would be after sort of 54 years. So this would be the progesterone, the estrogen and progesterone type. Estrogen on its own is very safe. And the other, but drinking 2 units of alcohol per day, an extra 5 per 1,000 women, an additional 3 in smokers, which is quite considerable, an additional 24 cases in women who are overweight or obese with a BMI greater than 35. So HRT itself is quite safe, lined up with these figures, but just that there are the different types.
Sure. So this is what we really need to discuss with our GP and not make assumptions based on other people's experience or other people's history.
Yeah, that there are choices,
lots of
everybody's different combinations, and not to be, the family histories are important, but may not be very relevant,
Yeah, and I suppose it's probably a balance between the likely risk versus the symptoms and how severe those symptoms may or may not be going through it.
Yeah, and lots of women won't need HRT, won't want HRT, and are fine without HRT. But some women definitely benefit, and their quality of life is greatly improved. There are products. It's very simple to go through what's safe for them. If one doesn't work, another will, and just staying on a low dose for a short period of time can be extremely helpful. So I suppose not to be afraid of it either. Be wary of it, but look at it and see if it's suitable for you, and it can absolutely sort of make a difference.
And I suppose one thing that I forgot to ask you earlier as well, Therese, the likes of HRT or that, does that help? I talked to a woman recently, and one of her biggest things was, as you say, the erratic periods. She would go so long and think she's nearly out, and then she would have this unmerciful flooding. Where there were accidents and stuff. And I know that's the extreme end of stuff, but it is often a thing that people worry about.
Yeah.
Particularly if they're prone to heavier periods during the menopause.
Yeah. I suppose with the menopause periods, the cycle changes. Periods can become lighter, or they can become very heavy. In the old days, like when I was a student, the treatment for these kind of heavy flooding periods was hysterectomy. But now Mirena has come along, and that, if it's a major problem,
this is the Mirena coil
will be used. It's the most thing that's now used for heavy, troublesome bleedings, which in many cases will cause a woman's blood count to drop down, so that she's dangerously anemic from these periods. If it's just one off or whatever, but some people are absolutely troubled with these incredibly heavy periods that are dropping their hemoglobin.
So that Mirena coil isn't just associated with birth control. It can actually be used,
and it's
very
useful.
Menopause.
It's probably the safest HRT for combination now is a topical estrogen, either a patch or a gel. Patches are in short supply at the minute, but patches are great. They don't put up the risk of clots, basically. And if a lady has a womb, you have to use progesterone to counteract the estrogen. So the progesterone taken by mouth is maybe what causes most of the side effects of HRT, the unpleasant side effects. So the Mirena coil does that job. So you can have your estrogen patch and your Mirena coil to provide the progesterone arm of the HRT. And it also serves as a contraceptive. So so for the lady who's under 50, having all these symptoms, still needs contraception, the Mirena coil is there, then all you have to have is your topical estrogen. So it's the best. It's probably the best combination.
Fantastic,
Yeah.
fantastic. Yeah, that's great. Trace, thanks so much for
Not
giving
at
us
all.
so much information. I've learned so much. We all have our own personal experience, but I've learned a whole lot of new stuff, which is fantastic. And I suppose, as you were saying, I'm one of those women that didn't need HRT. I find the physical activity, trying to keep myself as healthy as possible, the yoga and
Signs
stuff.
on it now,
Well, I'm not
absolutely.
saying, but I'm just saying to people that are maybe watching this thinking
Yeah.
I will be heading into the menopause.
Yeah.
It's not all doom and gloom
It's
by
not
any
doom
means.
and gloom. It's the next chapter.
Yeah.
And grab it and make the most of it. Absolutely.
Great stuff. Thanks, Trace. Just to say as well to staff, there's this very good guide that the HSC and the Irish Women's Council developed in relation to the menopause, and that's available as a download on healthpromotion.ie. Thank you.